So as Kate said, I'm with Academy Health, and I was delighted when Kay contacted me to invite me here to talk to you a little bit more about the health services research community and how you guys can get more involved in partnership and how Q and Academy Health could work together. So I always do this, conflicts of interest. I don't have any, and of course, I always say I wish I did because then I'd probably have different streams of income. But I just want to tell you very briefly, sort of to ground you in who Academy Health is as a membership organization, and then to kind of explore some ways to get involved the way we just heard with Jen, which was terrific. Now, how many of you have ever heard of Academy Health? Yes. This is the highest percentage I've heard. I ask that at all my audiences. But anyway, here is our mission statement, which I will not read for you, but I always use it to point out a few the underlying parts, which is that while we are the professional society for health services research and policy research, we really want to remind folks that we're about the professionals who produce and use this work. So it's not just about academic researchers. We work very hard to try to engage all the stakeholders in the knowledge generation and knowledge translation activities. And we work very hard with our members to do lots of different programs and services. And I'm going to just highlight some where Marianne and I worked together on this, where I thought there might be the most potential interest and synergy. But we also, importantly, to the point about sort of engagement in the guidelines work, one of the things we do a lot of in Washington in the national policy space, but also state policy space, is I like to say we set the table for conversations where evidence can be brought to bear on decision making. And you can imagine at this time of the implementation of the Affordable Care Act, there's a lot of policy conversations going on, and we try to bring forward as much evidence into those discussions as possible. So who are we? So this is a couple graphs. To the left is our individual members. Like Jen, we have individual members and organizational members. We have over 5,000 right now. We're at a high because we just had our annual research meeting with 2,700 people at it in Baltimore. So we have over 5,000 individual members, and we have 170 organizational members. And importantly, in the individual members, it's not just regular members, but we work very hard to engage students and expose folks who are training actively to become researchers through various programs of study, because we're very interdisciplinary, to learn about health services research. And what that means is also health services research of the future, which involves much more patient, consumer, et cetera, involvement, which I'll touch on. We also have lots of interest groups, and as I thought about all of you and which interest groups you might be, connecting with, while I think there are two that really jump out for me. The first one is advocacy, and I'm going to talk a little bit more about that one, but also the translation communications interest group, because we have 2 years ago we launched we started working on and then publicly launched a new translation and dissemination institute to try to help the field do a better job of translating evidence into policy and practice. And so working with the translation interest group, that would be, I think, very useful. I'm going to tell you a little bit about membership, but let me, there is regular membership, which is $175 for an individual, and you'll have our website and you can go check it out. And there's organizational membership as well, and the set of benefits are different. And so I'm going to explain each of those. But to join the interest groups, you don't have to be a member. So if you want to sort of get to know our community a little bit better, that could be a way to sort of join the listserv, find out what's going on in that interest group, and start getting more active that way. Because I think that certainly, as I look at it, advocacy, disability research, gender and health, quality and value, translation communications, lots of areas, and they're growing. In terms of our org affiliates, you might see here that while research organizations, the blues are 50%, we work very hard to have a diverse group of organizations involved with Academy Health, because that's how we see our connection. We really leverage our connection to users, whether they be policymakers, leaders of healthcare, and consumers and consumer organizations. And the reason I put this up very quickly is just as we think about health services research, there are a lot of demands and trends in the environment, the ecosystem, that are influencing how the academic and research community is thinking about their work. And this is a slide, I put it up to show that I talk about all these to all my audiences, and you'll see that the fourth bullet is demand for consumer, patient, stakeholder involvement. So I'm spending a lot of time giving speeches to my academic colleagues saying, guys, you need to be listening to this. This is, and I really have to do a shout out to Sue and Pecori, because they've sort of changed the conversation with the academic community, because they've made this so clear that this is a priority. And, academics are humans like everybody else, right? We respond to incentives and disincentives. And what's the biggest incentive? Getting a grant, money on the table. And if the way you're going to get that money is by actually, effectively engaging patients and consumers, you're going to take that much more seriously than before. So I think it has changed the context, and I'm certainly part of sending that message out to our community. If you're interested, it's on our website, is the official definition of health services research. Again, I put this up to show that it's long. I can't get it out in one breath. And what I tend to say is that health services research 2.0 is really about understanding what works. And importantly, for also thinking about patients and consumer groups, it's not a generic, one-size-fits-all answer. I'm a pediatrician. I've also focused a lot on disparities. And so the question is, what works for whom? Understanding, that treatment heterogeneity. How do you tailor interventions to the individual needs of the patient? Also understanding context, and I think that's where consumer and patient input really helps as well, to understand how that intervention, that clinical need, fits into the life of that patient, and that ability of that community to actually effectively engage in treatment. And cost is a huge issue. But I think the other question that we focus on a lot is, okay, once we know what works, how do we actually get everybody to do this reliably, effectively? How do we make sure that interventions get to all consumers and patients in all systems? So that's just setting the context. So what are some opportunities for consumer and patient engagement with the research community and with Academy Health as a window into that community? So first, I want to again tell you about sort of the way I think about this, because again, this is how I talk to our research audiences and our stakeholder audiences, that when we talk about patient-consumer engagement, it's really important to be clear about what kind of engagement we're talking about. There's certainly the care engagement, shared decision-making, involvement in all those ways. But there's also increasingly, as was alluded to already, the demand and the expectation that patients and families and consumers are involved in the change that needs to happen in healthcare, because, we all know change has to happen. And I spent 4 years at Cincinnati Children's, and you've probably all read the Atul Gawande article about CF, and that's just one example, but that's an organization that is very focused on transformation and also engages consumer patients and families at the practice and at the system level. So we talk about that also with our stakeholders. And then there's the area that you're very engaged in, is obviously what's consumer and patient engagement in the research process. And we've added one that is also the research enterprise. So just like you have involvement in care and then in systems transformation, kind of two levels in the care process, in research it's also involvement in the individual research project, but also the research enterprise, which frames and sort of shapes how the individual research project gets done. And I also, having done a lot of, I came out of the policy and academic community, and I worked in the state government and HHS. These are at least four different ways that we think about engagement, but the thing they all have is it's about end user engagement. Not only do we have to involve patients and consumers in issues that we and they and us care about, but also in policy. Policymakers want to be involved in framing the question just as much as a consumer does. And systems, or we hear a lot from organizational leaders, whether it's at KP or Intermountain, and we're partnering with them in different activities, that they say, well, we want to work with the research at the beginning because we want our questions answered and we want to frame it a certain way. Oh, this is quick. Okay. So this is a document that's on our website, and Marianne is one of the authors. And I think the fact that we even have Marianne on our staff, I mean, she comes with a background in consumer and patient engagement, is reflective of how we're seeing our research activities going. And this one, on the dark green side, is the sort of more typical the steps of the research process for an individual project. And for each of those, it talks about how to engage consumers and patients. But what I like about this framework is that on the right-hand side, it talks about ways to engage consumers and patients in the research enterprise. How do you set up the hardware, the software, the data elements, the care applications, the monitoring, how you actually think about the whole research enterprise and when you can involve consumers and patients in there. So that's on our website, and that's just some more detail. So what is possible? Well, first I want to talk about ways to partner with Academy Health, and then ways to partner with our members. And there's 5 of them here, and I will send these slides so you can all have them. But they're leadership roles, funding opportunities, meetings, etc. I'm going to go through each one very quickly. First of all, our leadership roles. Part of informing, just with like working with a guideline development group, is being part of the conversation, being in the room when that crucial conversation is happening. So we have not only our board of directors, we have board committees, committee on advocacy and public policy, membership committees. If you're interested, we'd love, again, you can contact me or Marianne in hearing more from you and your organizations about volunteering. We also have a consumer patient researcher roundtable that we've been convening. John's been involved. I don't know who else, if there are others from this group who've been involved, but that led to that sort of the work on that. One of the outgrowths was that publication. We also, not only do we do national conferences and the usual membership organization activities, but we also have a lot of grants and contracts that we pursue and have funded to help move the field, to work with the field to move the sort of how we do research. So the most recent example is we partnered with Q on a PCORI submission. Now, it's still pending, so we don't know. But again, we're always looking for partnerships. We've partnered with John at Consumers Union and would love to sort of explore that some more so that we can, when appropriate, with your organizations and with Q. Then we have our meetings. Now, our meetings are not cheap, okay? Just like any national meeting, they're not cheap. But there are ways to get involved that I think we've had in the past. We've received Kaiser support to have some consumer stipends so that consumer representatives could come. This last year at the policy conference, we tried to have patient-consumer perspectives on a number of our panels. We've never done that before. So again, if you're interested, if we know about that, we can reach out to you because we're trying to integrate that more and more into our programming. The Electronic Data Methods Forum is another activity I'm going to touch on. Those are our 3 main conferences. Our annual research meeting is in San Diego next year. Anybody here from San Diego? No Californians. Okay. But again, we reach out to the locals and we do a local delivery system meeting as well. The other thing is our fellowship and scholarships. I didn't know how to grab a screenshot the way you did of your website because I meant to put one in here quickly to show you where to go on our website. But we have a number of different scholarships that are available. One, for example, is a new one on innovators in residence where we're trying to get people from different perspectives to help us think about how to do translation communication differently. So that one was just launched this summer, so we'd love to hear from more of you. And then finally, advocacy, and importantly, because of ARC's important role in pushing not only funding Q, but really providing a lot of tools and resources for patient-consumer engagement, ARC is under threat right now in Congress. And so last year there was a proposal from the House subcommittee to eliminate it. So we are working very hard on advocacy, and we are going to be working on producing a report that we'll be using over the course of the next couple years on the contributions of ARC to health services research and improved health and healthcare. And we'll be looking for testimonials and people to go on record saying this is how we used ARC information and ARC evidence to improve health and healthcare. So we'll be reaching back out through K to Q because we'd love to get some patient and consumer testimonials on that as well. Our interest group I mentioned, it'd be great to have you involved. We're doing an op-ed campaign with the hometown newspapers for all of the key committee members. We've got system leaders and others. We'd love to have some patient and consumer voices, and we like hold your hand with that. We do it. We have a public affairs group does an interview with you and then drafts the op-ed and then sends it back to you. You can edit, so really to make it as easy as possible because those voices are critical. And then partnering with our members. As I said, we have over 5,000 members. If you join, you get our member email, you hear about what's going on. And if you join as an organizational affiliate, this is Jane's email. She's our director of membership. We'd really like to figure out ways that maybe on a case-by-case basis, if the membership level is too high, maybe there's some other ways we can work with you to get you more connected to our membership, to showcase your activities and Q's activities to our members so they know they can reach out to you and involve you in their research applications. And given that I'm out of time, the last thing I'm going to say is that we also have a new publication called eGEMS, where it was just launched in January. It's open access, peer-reviewed online journal, which is not about what we say the destination of journey, like what did we find in the research, but about how we did the research. And so, again, if you've got some great lessons about how do you involve consumers and patients with researchers, we'd love to talk to you some more about submitting. We've got 26 articles in review right now. 10 have been published. We've already had over 5,000 full text downloads. So just in 6 months, it's a very different type of journal. And this kind of experience of how do you actually effectively engage consumers and patients in research is something that other researchers want to hear about.